The new COVID vaccines are rolling out just in time for the fall and winter months. Tippecanoe County Health Officer Dr. Gregory Loomis shares what's new about these vaccines.
Based on this recent flavor or strain of COVID that's going around rather than the one last year, because as we know, this happens even with the flu.
Dr. Loomis recommends the new COVID vaccines to people with comorbidities and those living with immunocompromised family members. But if you've recently had COVID, you should hold off.
The vaccine really only works for about 3 months. That's when the antibodies are at their peak. So if you've had COVID recently, don't get the booster. Wait until further into the year.
If you do choose to get the new vaccine, an important thing to know is you might have to pay out of pocket. Dr. Loomis says prices may vary depending on your insurance and where you go to get the shot. For those without insurance,
the health department does have what we call 317s, and that will pay for your vaccine, your COVID vaccine. If you have insurance, the health department will bill your insurance. If you go to the pharmacy, they will bill your insurance or pay cash.
As of right now, Dr. Loomis is unsure when the updated vaccine will be available at the health department, but you can find a carrier at vaccines.gov. And Dr. Loomis says if you aren't feeling well,
stay home. Drink plenty of fluids, alternate Tylenol with some ibuprofen if you can take those medications safely. Always contact your primary care provider, your nurse practitioner with any questions, but just be safe.
You can consult with your medical provider to learn if the new updated COVID vaccine is right for you. Marguerite Incardoni, Star City News, Tippecanoe County.